you this particular MyCalPharm is being developed by Infocart India. We have two authors, Dr. Ravindran and Dr. Patil. Let me show you Dr. Ravindran. He is a legend in himself. You can see he's from Jipmer, Pondicherry, ex-professor. All his contribution to Ex-Pharm and MyCalPharm, you can see all his achievements are there, full page. Then we have Dr. Patil. He's with us also here. He will be demonstrating few experiments. He's a legend. He is National Teacher Award 2023. So let me go back to the MyCalPharm now. Let me log in. Let me show you few images of the experiments, which all experiments we have now, so that you can just have a look over it. All the experiments will be open to every login. Separate individual login will be given to faculties. They can access it anytime from anywhere. Regarding students in the medical line, we will be giving them separate logins, especially for the PG students. Simple login is done by email ID and password. Every individual, we will be sharing them email ID and password. They can just work here individually. Students are given small access to it. All the experiments, let me show you the tutorial mode. These are the list of the experiments which we have. First is the Ex-Pharm. Few experiments you can see in the Ex-Pharm: effect of drug on rabbit eye, bioassay of histamine by interpolation method, matching assay, effect of drug on ciliary motility. Few methods in experimental pharmacologies are there. Then we have the 5-dose response curve experiment. DRC of ACH, frog rectus we have, histamine we have, ACH is there, effect of spasmogenesis, spasmolytics are there. Then let me go to the calculation of PA2 and PD2 calculations. These are the 5 experiments which we have here. Then we have the bioassay 6 experiment, in which we have serotonin 3-point assay, oxytocin by interpolation, ADR we have. Then we have the bioassay of atropine. Few whole animals experiments are there. You can see here using actophotometer, elevated plasmase, electroconvulsometer, rotor rod experiment is there, effect of drug using Eddy's hot plate, Cook's pole apparatus, Pyrolus ligation. So all these experiments will be open to all the faculties and the students also. Similarly, we have reports are there. Whatever the student will be doing, the faculty will come to know what all student has done here. This is the report. You can see here 19,000 experiments has been performed in 1 week. This is the report part. Let me go to the practice. What all practice the student has done, you will be able to see here. Then we have the in the report section only examination report is there. What all the student will be performing in the exam, the student will be having the faculty will be having the access to it. In the practice exam, all the experiments, all the examination are open to all the students. They can just access it anytime, and while accessing, they can perform any examination, whatever they like, because this is the practice exam for the self-evaluation. When the faculty will be scheduling exam, then they have to go to the final exam. So this was just the overview of MyCalPharm. Regarding the dashboard, I will be telling you the suppose you were just logging into the dashboard into the MyCalPharm. So you will be able to see the subscription date, how many experiments are there, how many experiments are open to you, who have login up till now. The faculty will be able to see what exactly is the weekly activity report of all the students, what are the recent experiments or the recent page, or how many experiments are being conducted in 1 week or say 1 month. So the faculty will be having access to all the things in my CalPharm. In some time, I will also be explaining you. We have two workshops here: statistics workshop and research and methodology workshop. So right now, I will be just inviting Patil sir. He's here with us. He will be giving you an overview of MyCalPharm, and also he will be explaining you few important experiments here. I'm just stop sharing my screen as he will be doing it. Patil sir, are you there? Patil sir, you muted.
Good morning, madam. Is my screen visible to all?
Yes, sir, it is visible.
Thank you. So at the outset, I'm thankful to Infocart India Private Limited, Kunjan madam, for giving me this opportunity to demonstrate few experiments from MyCalPharm. Actually, this particular package, when Dr. R. Ravindran started working on it, his intention was to make his subject as interesting as possible for his students. And then the purpose behind creating such kind of software package was to enable the learner to get all the details, minute details regarding the experimental procedures, and beyond that, whatever theoretical aspects we are trying to teach to our students, it is expected that they should develop interest in it. Okay? No doubt, some animal experiments are becoming historical aspects of the subject now, but still, when we want to teach them the regular pharmacology related topics in our theory classes also, we need some powerful tool and educational aid to incorporate in our pedagogy, where we are expected to engage our students in such a way that they understand the entire subject and the learning process becomes very interesting. Okay, so through this particular demonstration of few experiments, I will be trying to show you how this powerful tool is becoming a real teaching aid, a real companion for all the professors who are trying to deliver the contents related to pharmacology subject. So let's start with the first experiment, that is dog blood pressure and heart rate and effect of drugs on dog blood pressure and heart rate. So if we all, particularly experienced pharmacologists, know, then this experiment is a classical experiment which is used to teach autonomic nervous system related pharmacology as well as cardiovascular pharmacology, where many tricky points are there, many intriguing points are there, which we have to deliver to our students in such a way that they understand the gist of the subject. So, to tell about this classical experiment, the entire experiment has been divided into different parts. Now, by doing this experiment, what we are expecting from our students to do, it has been given in the objective for this particular experiment. Then whatever setup we are using, that has been given in detail. Then how the experiment is actually performed, how the dog is mounted and all, that has been shown here. No doubt, in present context, to perform this kind of experiment on large animals, we need permission from central government's CPCSE or CCSE. Okay, but for our students to understand how actually this experiment was performed, all the details have been, all the minute details have been given in these images now. Once students are introduced to this, then we have to take them to the experiment. Okay, where very stepwise instructions, clear-cut instructions have been given to the learner, and even teachers can deliver these contents to their students. So instructions have been given in each practical. And now let us see a couple of examples how we can use this particular powerful tool to make our subject interesting. Okay, there is a concept called as Dale's vasomotor reversal. While teaching autonomic nervous system related details, sympathetic nervous system related details, we have to tell our students regarding Dale's vasomotor reversal. If suppose you are using just chalk and board or some PPTs, it is very difficult to deliver such kind of concept or convey this kind of concepts. Again, in all our pharmacology books, when we start teaching sympathetic nervous system or sympathomimetic drugs, we see a very interesting uh, recording of effects of adrenaline, noradrenaline, and isoprenaline on blood pressure. Okay, but as it is a static content in the textbook, where there is no interactivity between the content and the user, students do not develop interest regarding this. But if you are using this particular tool, you can tell your students how the effects of adrenaline, noradrenaline, and isoprenaline differ from each other. So now what I have done, I have selected epinephrine here and I have injected 2 microgram per kg of it. So this
Sir, your screen is not visible, sir.
screen is not visible, you're saying?
No, it is authentication keep alive is there.
Just a minute, I'm sharing it once again. Sorry for that. Madam, is it visible now? Hello?
Yes, sir. Now it is visible, sir.
Okay, so let me start once again. So I was telling you that this particular interesting experiment has been designed to help teachers and students to understand the subject properly, for teachers to deliver these details properly, and for the students to understand what is meant by particular type of event. Okay. Now I was telling you about the interesting thing that we are trying to teach to our students, that is difference in the effects of adrenaline, noradrenaline, and isoprenaline. So I told you that in this particular interface, we are seeing the tracing of heart rate of an anesthetized dog and blood pressure that is being recorded through carotid artery. Okay. Then, if you see the introductory part, then in this particular procedure, it has been shown how we are isolating vagus nerve, okay, and how electrically we are stimulating that nerve. Okay, so this kind of details have been demonstrated to students, and then through femoral vein, we have to keep on injecting the drug to the animal and record the effects on kymograph. That was the conventional way. Now we are using it using a polygraph or a digital data acquisition system to record these effects now. Okay. So I hope this particular thing is clear to you, how nicely this complex experiment has been designed and presented to the users. So once we inject adrenaline, we have recorded some response of adrenaline on the dog blood pressure as well as heart rate of the dog. Then we will be injecting norepinephrine. Okay. So when we inject 3 microgram per kg of norepinephrine, we see a rise in blood pressure. Okay. Adrenaline is also a sympathomimetic drug. Noradrenaline is also a sympathomimetic drug. And then we will be trying one more sympathomimetic, that is isoprenaline. Okay. When we inject isoprenaline, the kind of effect that we get is fall in blood pressure. So if suppose you are having a class of 100, 200 students in front of you, and to them you have to explain how these 3 sympathomimetic drugs differ from each other, and then you want to introduce the concept of receptors to your students. Okay, if you utilize this kind of teaching aid and on your smartboard, if suppose you are demonstrating this particular thing, then very nicely you can present the differences between effects of these 3 sympathomimetic drugs. Okay, here when we are injected adrenaline, we can see that there is a rise in blood pressure and then there is a fall in blood pressure. Okay, this is what we call as biphasic response of adrenaline. Okay, just using a didactic lecture or just using PowerPoint presentation, you may not be able to tell what is meant by biphasic response in such a nice way. Okay, no doubt teachers are having their capabilities to deliver the details of the subject, but then if they are empowered with this kind of teaching aid, it becomes far more effective for the teachers to deliver the contents of the subject. So what I'm telling is, when we are giving adrenaline, there is rise in the heart rate. Initially, there is rise in blood pressure, and then there is fall in blood pressure. And this is what is biphasic response. Now let's shift to what noradrenaline is doing. Noradrenaline is increasing the blood pressure only. We do not find any fall in blood pressure. So noradrenaline is having only monophasic response. There is only rise in blood pressure. Okay. Whereas isoprenaline, even though it is a sympathomimetic, it is causing fall in blood pressure and rise in the heart rate. Now this is how you can start introducing the concept of receptor pharmacology. Then you will be telling your students that adrenaline is having effect on both alpha receptors and beta receptors. Alpha receptors, which are present in the peripheral vasculature, they get activated and they cause contraction of peripheral blood vessels, because of which we are finding some rise in blood pressure here. But Along with that, there is beta effect of adrenaline also, because of which it causes dilation of the skeletal muscle related large blood vessels where these beta receptors are present. And due to this dual effect, adrenaline is causing rise in blood pressure earlier, followed by fall in blood pressure. Okay, so adrenaline has agonistic action both at alpha and beta receptor. This is how you can tell your students how adrenaline is affecting heart rate as well as blood pressure. In case of heart rate, as adrenaline is acting on beta receptors in heart, it will be causing rise in heart rate. When you shift to noradrenaline, an interesting thing is happening here. There is a fall in the heart rate. Okay, this red line which is indicating the heart rate. We can very nicely show our students that noradrenaline when you are injecting, noradrenaline is causing means striking rise in the blood pressure, but simultaneously there is fall in heart rate. Why this is happening again? Because noradrenaline is not acting on heart. There is no effect on beta receptors related to noradrenaline. It is purely alpha agonistic kind of agent. Okay? Because of which we find rise in blood pressure but fall in heart rate. When we shift to third sympathomimetic, there is again fall in blood pressure. This is because of beta adrenergic receptor agonistic action of isoprenaline. And as it is affecting the heart also, because beta receptors are present in heart, so in case of isoprenaline, we will be finding fall in blood pressure, rise in heart rate. Now, once we deliver this contents to our students, we can shift to a more complex construct, that is Dell's vasomotor reversal. Okay. It will take quite a long time to explain our students what is Dell's vasomotor reversal by using chalk and board or just PPTs. But here you are having a live experiment going on your smartboard where you can ask your students to try one alpha antagonist, which is pentolamine. So in this experiment, after recording the effect of 3 sympathomimetic agents, I have now tried to inject, or I have injected pentolamine at 1000 microgram per kg dose. And as it is an alpha antagonist, it has caused fall in blood pressure to some extent. Okay. Now, once this dog experimental setup, anesthetized dog, has been injected with a high dose of alpha antagonist. And what we want to demonstrate to our students, we want to tell them about Dell's vasomotor reversal. Okay. Now we will be trying adrenaline on this particular setup, on this mounted dog. So after pentolamine, which is alpha antagonist, I am giving or I am repeating the same dose of adrenaline in this dog in which all the alpha receptors have been blocked by high dose of pentolamine, which is alpha antagonist. So let's see what happens here. When I inject adrenaline again, what I'm finding here is a sharp fall in blood pressure. Okay. Now we can ask our students why this particular thing is happening. After administration of alpha antagonist, pentolamine, why adrenaline is just showing fall in blood pressure and there is no rise in blood pressure, which we had seen earlier in absence of pentolamine. Then we can ask our students to find out the reasons for such fall in blood pressure. Already we have tried to introduce to them something regarding alpha and beta receptor concept, effect of alpha and beta receptor stimulation on blood pressure and heart rate. And now we have posed this particular question to our students. Why after pentolamine, adrenaline is causing only fall in blood pressure and there is no rise in blood pressure? If we start telling the students like this, then it will be developing quite a great interest on the part of students, because they'll start looking at the reasons why this particular thing is happening. Initially, there is rise in blood pressure or biphasic effect was there, but after pentolamine, we are just seeing fall in blood pressure. And like this, we can stimulate students' interest in this experimental pharmacology related aspects or even theoretical aspects. Then we can ask our students what will be the consequence if suppose there is rise in concentration of adrenaline in a patient suffering from pheochromocytoma. Okay. If suppose you administer phentolamine to a patient suffering from pheochromocytoma, in whom there is rise in adrenaline level, what will be the impact of this kind of drug on their blood pressure? Okay. So like this, we can make a very complex subject more and more interesting, and layer wise, we can go on introducing our students to the concepts of pharmacology. So I think you are getting how this particular powerful simulation not only helps us in telling about the practical aspects of pharmacology, but it is also helping us in telling to our students regarding very complex concepts related to autonomic nervous system or cardiovascular system. There are many such other examples. Again, if suppose we want to perform such kind of experiment, no doubt it is not performed in for demonstration purpose now. We are using rat blood pressure as an experiment. But then to demonstrate multiple drugs at the same time, it is needed that we have to change the dog also, because already we have administered alpha antagonist in this particular dog, a high dose. So that alpha antagonist will be affecting all other responses of other drugs which will be tested in this particular dog. So here we are having facility to change the dog also. Okay. If you want to change the dog, you can change the dog by just clicking on new dog here. Okay. And then you will be provided with a new anesthetized dog, a new set of drugs, a new set of procedures that you want to try in this. Now let's look at one nice experiment related to physiology. Okay. In physiology, when we try to tell our students how baroreceptors affect blood pressure, there we have to tell our students regarding the experiment of carotid occlusion in dogs. Okay. So here, when we apply carotid occlusion means what? The blood vessel which is providing, artery which is providing to brain, that artery we are blocking for some time, for few seconds. And what we see here, if the artery supplying to brain is blocked for some time, then there is rise in blood pressure. Okay. Again, we can stimulate our students to think about this, why this is happening. Why blocking of carotid artery for a while, for a few seconds, is increasing blood pressure in dogs. So this also will increase their interest in looking at what is really meant by baroreceptor, where is the position of baroreceptors, how aortic arc or the branches coming out of aortic arc and presence of baroreceptors there is affecting blood pressure. So such kind of details we can make them more interesting by using this particular experiment. Then to tell about the effect of central vagus stimulation on this dog blood pressure, here also we can ask our students why central vagal stimulation is increasing blood pressure rather than reducing it. Okay, which will be associated with overall activation of the sympathetic nervous system if we are electrically stimulating the central vagus nerve in this anesthetized dog. So like this, whatever complex concepts are there in physiology or pharmacology related subjects or their therapeutic implications, all these things have been very nicely simulated here. There is one more similar experiment of demonstration of nicotinic effect of acetylcholine. That is a very complex experiment where we have to go on repeatedly increasing the doses of atropine. Followed by that, we have to go on increasing the doses of acetylcholine. So such kind of classical experiments which tell us about the role of nicotinic receptors in blood pressure, the way in which acetylcholine stimulates nicotinic receptors when all the muscarinic receptors are blocked in the animal's body. All these things have been simulated in this particular experiment, single experiment of dog blood pressure. So just I am demonstrating you one experiment, and using this one experiment, a teacher can very nicely explain the intricacies of his subject to the students. So that is the power of using MyCalPharm in your routine teaching learning process. I'm not only emphasizing here use of this particular MyCalPharm for experimental pharmacology. I'm also telling you that you can use this powerful tool in your routine lectures, where you can select an experiment out of this particular 45 to 50 experiments which have been included. Based on that, you can demonstrate very important concept of your subject. You can stimulate students' interest in learning about the mechanism of actions of drugs, receptor concepts. All these things have been nicely simulated here. And you have been given freedom to utilize multiple animals. You have been given details regarding, or if you see the dose range, then you can go on increasing or decreasing the doses here. It is not that the static information is being provided to you. Then if suppose you want to remove the blocker, that facility is also there, because practically you cannot use remove blocker facility on your wet laboratory experiment. But here, for making your teaching learning more lucid, more convenient, all these facilities have been included in this particular powerful tool. Okay. So I think I have conveyed you how nicely you can teach the subject of pharmacology, both theory as well as practical, and how in a single presentation you can demonstrate cardiovascular effect of the drugs, autonomic nervous system related effect of the drugs. Okay. So this is how the things have been made very easy to handle, very user friendly. Now, when you go to this observation, you can ask your students to select which drug they have used, what was the mean blood pressure that they have got here, because you can ask your students to see what was the highest rise in the blood pressure by just moving this cursor here. Okay, I think this cursor is visible to all of you. Just by moving the cursor, you can ask your students to record systolic blood pressure, diastolic blood pressure. This will be diastolic, this will be systolic blood pressure, and then how it is rising. And then you can ask your students to also record how heart rate is increasing. Okay, so this red digits which are there, they are correlated with heart rate. So see, to develop this kind of uh, experimental package, there is need of veteran pharmacologist. And Dr. Ravindran has taken up this responsibility to create the best possible teaching aid to teach pharmacology to both medical students, pharmacy, and paramedical students also. Even veterinary students are using this particular software package. Then, for each experiment that has been performed, a log is generated. Okay, means when you started the experiment, what were the drugs you selected? So, if suppose you want to check what your student has really done in this experiment and how he is trying to understand the subject, then these logs also are provided to the teachers to evaluate the students. Okay, this is available in exam mode also. So, whatever is being performed on the screen, that entire aspect is recorded in the logs. Okay, in observations, the user has to enter what was the basal blood pressure, then what was the basal heart rate. Then there are some questions which have been added in this to make the students better understand the entire experimental details as well as theoretical details of the subject. So there are multiple such kind of questions. Okay? The artery used for measuring the blood pressure in experiment is, what is that? Okay, so we are using carotid artery for this purpose. So like this, the learning has been made more and more interactive. Okay, through which when we are administering the drug. So that was the femoral vein as well, as I told you. So like this, all experimental details will be understood by the student. And then ultimately, a report will be created. It's when the student performs this experiment, whatever steps he has taken, whatever answers he has given, whatever details he has understood from the experiment, everything is created in a consolidated report using this particular button which has been given to us. So like this, more than 45 experiments have been created in this very powerful tool of MyCalPharm. Okay. Let's shift to one more experiment now. Madam, is this experiment visible? Kunjan, madam? Kunjan,
Yes, sir.
please confirm whether this, yeah, is it visible to you?
Yes, sir, it is visible, sir.
Okay. So another classical experiment is isolated and perfused frog heart. No doubt, this experiment also tells us about effects of drugs on cardiovascular system. But there are certain minute details, like when we are using frog heart as a experimental package or experiment, there we are perfusing the heart in the same direction as the blood flows through the heart. Okay? But if you are using the modern tool of Langendorf's heart assembly, then you are using retrograde perfusion. Okay. Now, if you want to explain this thing to your students, just with chalk and board or PPT, you cannot explain that. But if suppose you are having such a high definition video in front of you, where you will be telling your students what is meant by sinus venosus and how it is cannulated, then your students will be understanding it much better, and that will be retained in their memory because of this visual piece that you are providing to them. This is really the high definition recording of all the experiments which are there. We have generated this particular frog heart experiment. Then there are dissections related to rat ileum, rat stomach strip, rat anaphyseous muscle, guinea pig ileum, rabbit jejunum. All these muscles, isolated tissue experiments have been recorded in such a nice high definition manner, and they are provided to the users along with the related titles, subtitles which are there. And one more thing is there. If suppose you want to hear the narration, if you want to listen to what is really described in this particular thing, then just you have to click on unmute, and you will be able to listen to the complete description of this particular experiment. All the procedures, all the steps, they will be narrated to you. So even this narration facility has been provided in this particular software package. See here very nicely now, cannulation of sinus venosus in frog heart is being demonstrated. So when we use Symes cannula, we take a cut here, and then Symes cannula is inserted into sinus venosus. It is tied, and then the entire heart is isolated of the frog's body, and that heart remains active. So this entire demonstration is available in such a high definition manner to the user, so that learner understands what is the importance of this particular experiment. Now, once that heart is isolated and mounted on the stand, along with continuous perfusion, then we can study effect of different drugs on this particular heart. See now, we are seeing the isolated heart here, which is continuously beating. There is continuous perfusion of frog ringer solution. And then we have been provided with simulated drug solutions where we can select different drugs and go on injecting to this particular heart through the Symes cannula. Through Symes cannula, we'll be adding the drops of that drug solution, 0.1 ml, and it will be affecting the contractions and relaxation of heart. Okay, so this is how you can demonstrate to your students how electrolytes are affecting activity of heart. Okay. So these classical experiments are there which are necessary while even teaching the subject in routine theory classes. Okay, in practicals it is necessary, but beyond that, even in theory classes, you will be needing this powerful tool to tell your students what is really happening. And then all the tracings which are coming here, we will be continuously, student will be entering these details. So when we are adding this, what is the heart rate that is to be added? 71 is the heart rate now, and amplitude of the contractions has increased. So like this, all the effects will be studied by the student. Okay, so along with live demonstrations of wet lab experiments, that too in a high definition manner, in the best possible way, performed by pharmacological experts, that has been provided. And with that, we are providing you simulations also, simulated experimental package. So similar multiple experiments are there. I'll be showing a couple more experiments to further elaborate, highlight what are the important aspects of this particular subject. So pharmacology teachers who are there, they can appreciate how we can tell about the antipsychotic effect of drugs, okay, using conditioned response. So all pharmacology teachers, while explaining to our students what is meant by conditioned response and what is meant by unconditioned response and how antipsychotics selectively suppress the conditioned response, this classical experiment is used, which is called as Cook's pole apparatus. Okay, so here to demonstrate what is meant by conditioning and how actually light, buzzer, and shock are used to condition the animals, we have very nicely tried to make it very interactive. So now the rat has been kept in the Cook's pole apparatus. It is slightly exploring its surroundings. Now we want to give it a light signal or light stimulus. So when you click on this, the light signal will go on. So animal has become conscious that the light signal has been put on now. And then after 10 seconds, when this light signal has gone up now, after 10 seconds, we'll be giving a buzzer signal. So like this, you can give buzzer to the animal here. And after 10 seconds of that buzzer, we can then give electrical shock to the fruit grid. When I give the shock, the animal climbs on this pole. Okay, so this is how we are conditioning the animal to escape from the shock just by looking at light signal and hearing the buzzer signal. So this is how the animal is getting conditioned to light and buzzer signal. Okay? So if you are teaching regarding antipsychotics or pharmacology of antipsychotics, there we say that major tranquilizers selectively inhibit conditioned response. But then just saying this thing and then demonstrating the experiment like this to the students, it has a vast difference in the level of assimilation of the knowledge. So once your students understand that conditioned response is learning to escape from the forthcoming shock just by looking at light signal and hearing the buzzer signal, that is we are considering as conditioning. And then in actual experiment, when the drug is administered, we will be able to demonstrate, or the students will be able to see on screen that only conditioned response is blocked by antipsychotics. But if you give food shock, then the animal will be still climbing on the central pole of this Cook's pole apparatus. Such experiments you cannot demonstrate in wet lab because they are very hectic. You have to train the animals for a week. And then there is again biological variation. This animal will not be showing expected responses every time. But if you are using this powerful tool, you can very nicely explain to your students what is meant by conditioned response and how a particular drug, class of drugs, antipsychotics, inhibit only conditioned response and no unconditioned response. But if you give diazepam-like drugs or other sedative drugs, barbiturates, then they will be inhibiting both conditioned and unconditioned response. So like this, you can teach your subject far more effectively if you are using MyCalPharm for your theory as well as practical classes. Beyond this, there are other experiments like bioassist or dose response curves or effect of antagonist on shifting of dose response curve. So all these details have been very nicely simulated here. You can see how the tissues are isolated, how the tissues are mounted. All these are provided in the best possible manner to the users. Okay. So isolation of the stomach and preparing the stomach strip itself is a very minute process. And even in conventional classes, practical classes, people could not demonstrate this to a batch of 25 or 30 students. But using this powerful tool, all the minute details related to dissections and all we can see here. And students will be appreciating which part of the stomach is being isolated when we are saying that it should be cut at the lesser curvature, what is meant by that. Then while preparing the stomach strip, when we say that it has to be cut in the zigzag manner and all, what is meant by that. So everything has been very nicely demonstrated here. Okay. So using this tool, your students will be understanding how conventionally people have studied effects of drugs like serotonin or histamine or acetylcholine on the stomach strip. Okay. And then we will be having a simulation of this also, where we will be provided with drug solutions. We will be provided with steps to give wash to the tissue, then select the drug solution, administer the drug solution, and then perform bioassay of acetylcholine. Many times, these experiments we cannot tell just by description. Okay, so we must provide our students with facility to perform the experiment, record the real observations related to this particular experiments. So here, whatever tracings are there, we have provided the facility to record the height of each response. Okay, and that we have to enter into this table. So this 3-point bioassay, where we have to tell our students how to select low dose substandard, high dose substandard, then the dose of test which gives response between these two uh, doses of standard drug. All these things have been demonstrated very nicely in this. Students will be actually performing this entire bioassay as per the guided instructions. They will be provided to student, and whatever student is performing, all those details are again recorded here. So how student has taken steps to perform bioassay, even that will be available to us. Okay. Beyond this, we are having multiple experiments where the things are very tricky. Like if suppose you want to show your students what is meant by tonic convulsion, or what is meant by clonic convulsion, where there are continuous jerks coming in the extremities. So these minute details you cannot tell to your students if you are not having this particular efficient tool. Okay. So here I am finishing my demonstrations. We are having more than 45 such experiments. Whatever systems are there, C elevated plasmas is there, locomotor activity, anticonvulsant action, CNS depressant, then analgesic action, anti-inflammatory action using plethysmometer, then mast cell degranulation related assay. All these things have been very nicely created. The complete demonstrations have been given. And if you start using this particular powerful tool for your theory as well as practical classes, your teachers will be feeling the pleasure of really providing the details to their students. And I'm sure that students also will be developing interest in the this complex subject, which is considered volatile by medical students. They will be considering this particular tool as a way to retain the subject details more efficiently. Okay. So there are multiple experiments. We can talk for hours together to demonstrate these experiments. But then if you start using these details, I'm sure that you will be feeling the real pleasure of teaching in your classes, both practical as well as theory classes. Okay. So with this, I'm finishing the demonstration of these few experiments, which I had the responsibility that was given to me. And thanks for providing this particular opportunity, and thanks for your patient listening also. Okay. I'm stopping the screen share now. And over to you, ma'am, please.
Thank you so much, sir. So I'm sharing my screen. I will be giving you small explanation about examination mode, how examination can be scheduled, and how students will be performing it. Let me tell you, this some colleges are facing problem in scheduling the exam, as it is a somewhat complex thing. I'm just explaining you. This is the scheduled exam. In the experiment, we will be going to the scheduled exam. Whatever date you want to schedule the experiment, schedule the exam, whatever date, let it be today. As you can see, even tomorrow some college have scheduled the exam. These are all the examination dates which have been scheduled. Let me schedule it for today, 24th March. Here I will be getting as add exam. Here we just have to give the name of the examination, exam one, or any sessional exam, any exam name you want to give, you can just give it. Student year, from here, student year, we just have to select, let it be MBBS second year. Name of the experiment, which experiment schedule you want to give for examination. Let me select it, examination one, rabbit eye. There are different types of examination for every experiment. Like here, rabbit eye, we are having two exam in the three exams. I've taken examination one just to show you how it will work. Passport, to start the exam, you can give any passport, any series of number or anything you want to add. It will be only numbers. You can just write here any number, which the faculty has to announce when the students are. See, the thing is that this is completely online mode, which can be accessed from anywhere. Any student can open the final examination and start doing exam. So they have to, what we have done is that student has to come to the cal lab to start the exam, that to conduct the exam. So whenever the students are coming to the cal lab for performing the exam, a small passport has to be shared. This is the which has to be shared with the students to start the exam. As student will be entering this particular number, their exam will be started. If any instructions are to be given by the faculty, you can just write it here for the examination. So in every exam, we have given that a small mandate is there. Suppose in the rabbit eye, you have to select minimum of 3 drugs. Here I have just selected all the drugs. If suppose your college is not studying all the students, you are not showing them all the effect of drug, so minimum of 3 drugs has to be selected here to schedule the exam. So I am just adding the exam created successfully. This you can see InfoCard College of Pharmacy final exam has been scheduled. So this is the scheduled exam. Let me go to how examination will look like. Right now, I'm just opening the practice exam mode, in which you can see here 2 types of examination are there for the rabbit eye. 3 are there for dog BP and HR. 2 are there for the frog esophagus and frog heart, and few other examinations are there. You can see here all the experiments examination are completed here. Let me start with one of the exam. Let's say rabbit eye examination 1. I'm just opening here. This is the task for effect of drug on rabbit eye. Whatever the student, they have to just identify the effect of the drugs which will be given to the rabbit's eye. Let me start with this particular examination. This is the experiment. This is the setup of this particular experiment or examination. I'm just zooming it so that we can completely see the effect of the drug. So in the tutorial mode, what happens is this setup is the same. Here you are given the options of all the drugs, which can one by one the student will be picking up the drug, injecting it, and they will be seeing the effect. But since this is the examination mode, so all the drug names are unknown, starting from unknown 1 to unknown 5. They can just pick up any drug and insert it into the right eye, left eye, so that they will be getting to know the effect of the drug. Here we have the tools. Let me show you how the tools work. Let me pick up the light effect. By the torch, we can see the light effect. In the normal eye, light effect is there. So when we will be just inserting the drug, then we will be seeing whether the light effect is present or not. This is the cotton wool effect. It is there. This is the scale by which the reading will be done. How much is the width of this particular eye? Pupil size, we can just measure it. One scale, we can see 1 mm is there. For every scale reading, 1 mm is the size. This is the tono pen by which the intraocular tension can be measured. 17 is there. First of all, we will be washing the eye with the saline. After that, we will be adding the drug here. Since every drug is unknown right now, so I will be picking any drug, let's say unknown 1 I've taken in the right eye. By picking up the dropper, adding it, you can see it is being added into the eye, and the effect it will be shown here. All these experiment in the tutorial mode, everything is being explained. But when we come to the examination mode, nothing is there. The student has to do all the things themselves. So ethically, it's not correct to add 2 different drugs in the different eyes, but it is a software, so we are just doing this also to reduce draw time. Adding unknown 2 drug in the left eye. Effect is not there. Let's us see the light effect is there in the left eye. Right eye is also there. So light effect is there. Cotton wool effect is also there. Scale, by the scale, we will be measuring the pupil size. No effect is there on the left eye. Same size is there. In the right eye, we can see the change is there in the pupil size. By this, we will be measuring it. Uh, the each division in the scale is 1 mm. Let me check the intraocular tension by the tonopen. It is same in the 17. Rather, in the right eye, it is in unknown 1. Intraocular tension is less. Let's go to the observation page. In the right eye, we have taken unknown 1. Left eye, we have taken unknown 2. So by here, we will be just selecting it. Before the intraocular tension was 17. So in the right eye, now it is 16. The difference will be measured here. In the light reflex, both before and after, light reflex was the same, it was present. Corneal effect was also the same before and after. So pupil size before it was 8 mm, and after in the right eye we have measured it is 14, and here again it is 8. So whatever is the difference, we will be just writing it. So by checking what exactly is the intraocular tension difference, light effect, corneal effect, so here we have to choose what exactly will be the unknown one. Any guesses we can you can just tell, or student will be able to identify which particular drug is unknown one. And from here again we have to choose what exactly will be the drug in unknown 2. Unknown 2 doesn't has much difference, so I'm just taking it as, let's say, saline only. Let it be normal saline. Unknown one, let it be epinephrine. So whatever the students will be choosing here, unknown one and unknown two, the faculty will come to know what exactly the student has done here. If I just go back to the experiment, again we can use more number of drugs here by washing with the saline. So when actually we are in the lab, we cannot perform this particular experiment so many times. We cannot practice on on rabbit so many number of drugs. We cannot uh, add it here. But since this is a software, we've given you such a good option. Here you can just choose any number of drug, wash with saline, see the effect. Everything can be done here. Any number of times you can use any drug here. So here we have taken right eye with unknown 3. Let me take unknown 4 with left eye. You can see the effect here for the unknown 3 and unknown 4 also. So again, by torch effect, we will be seeing the light effect, whether it is present or not. Same is to be done with the cotton wool effect. It is not there. In the right eye, we can see unknown 3. Light effect is, sorry, cotton wool effect is not there, which is very important to see. Very important term to note. This by here we will be measuring it. What exactly is the scale? By tonopen we will be measuring. We can see here the tonopen by intraocular tension reading is different. Now it is 14, and here again unknown 3 it is 17. So here again adding row again, right we have taken unknown 3, left we have taken unknown 4. So whatever is the changes or whatever the student has done here, it will you just have to, before it was 17, whatever the student has done here, they will be just noting it down. By noting it down, they will come to know what exactly is the difference in the drugs and their reactions. And similarly other things has to be noted down. So by here unknown 3, they have to measure what exactly is unknown 3, then again unknown 4 they just have to tell. So like here, whatever any remarks is there, the student can note it down, any remarks. For every experiment, the student has to give answer to the questions. We can see here what is the mechanism of action of lignocaine. Name some clinical practice myotics. What are the clinical uses of myotics. So for every experiment, we have given a set of written questions which has to be done in by the students. This is the examination mode where we want the student to even write their questions. So they just have to submit it. If the faculty is around, let me show you how the report is being made. Suppose the examination is complete, whatever the student has done, they've already completed it, answer the question has been done. A report has to be submitted it in by the students. Whatever the student has done, a report will be made, a PDF will be there for the faculty to access it. Let me open one PDF. Like this is the PDF which I've made as a student. My student name will be there, email ID, name of the experiment, whatever the student has done in the observation table will come in the PDF. Identification, what the student has noted, like the unknown drug, it will be there. This is the unknown 1, 2, 3, and 4 has been worked on. Unknown 5 has not been done. Log is there. Suppose the student has not written these particular table, they have not filled, but in the logs you will be able to see what exactly the student has done, which unknown drug has been selected, whether they have instilled it or not. You will be able to see everything. These are the written questions. What all the student will be answering, it will be there in the PDF. So this is the correct answers. Right now I've just taken randomly here. Only one is correct, which is this line. Rest all are wrong. So the faculty will come to know what exactly are the correct answers and what or not. Accordingly, seeing their responses, seeing their answer the questions, you will be able to give them marks or the remarks in their examination mode. Like if the faculty is around, they don't want to see the report, they want to write it here only, they want to check it here only. This is the result one. The faculty, a pop-up will be there, which by which you can just enter that particular same passcode which you have entered when you were just creating the exam. And then after that, you will be able to see the result here. So this is the one examination mode which I was about to show you, effect of drug on rabbit eye. And similarly, all other examination modes are there. Let me go to the report section. How examination report you will be able to see. Like here, the examination reports are there. Let me open any report for you. So here, exam, college name, student detail will be there. This is the experiment, which experiment it is. This is the effect of atropine on TRC. Whatever the observation is there, the faculty will be able to see it. You can see the complete table is there. What all student has done, you will be able to see. This is the graph which was being generated. It will also become a part of the report also. This is the PDF tracing. Whatever the tracing are there will also be a part of the PDF. Logs are there. What the student has done, you will come to know here. MCQs, every experiment is accompanied by a set of the MCQs and a set of the written questions. So whatever the student has done, whether they have answered or not, they have given the correct answer, wrong answer, or whether they have attempted it or not, every faculty will come to know here. If they have not done, we are also giving you the correct answer to all the questions here. So by seeing the report, the faculty will be able to give them marks or remarks according to what the student has done. Examination report will go only to the faculty's PDA, faculty's account, and student will not be able to have the access to the examination report. By here, the faculty will be able to give them marks or remarks depending upon the students' observation. Any remarks you want to give, you can just give. If you want to share this particular PDF with the student, you will be having the option to select here yes. If you don't want, let it be known. So this was the examination report. All these report you can just download into the Excel and use this particular Excel as your result. Then we have few very important things. Let me show you the learning resources where all the videos are there for every experiment. If something is not there, you can just tell us. We will be adding that also. How the exams is to be scheduled and how the result you will be able to do it. Everything we have just explained here. A very basic a very important thing which I am missing out here is that many students are facing issue of multiple logins. Let me clear that out. Every student login, see faculty login, you can access it from anywhere. But when the student login is there, only one login has to be worked on every computer. Suppose one login is there, student user one at the rate any college name, it cannot be accessed by two laptop. On one computer or one laptop, only one email ID will be working. That's why we give multiple logins to every college. How many CalLab in your CalLab? How many computers are there, or how many laptops are there? We normally give that many number of logins to you. If you want more number of logins, you can just send us a message, and we will be happy to give you more number of logins also. One very important thing, if some students are facing multiple login issue, this from here there is an option of giving of having devices. By devices you will be having the access to how many students are active right now, and you can from the action you can just make them log out and then let the student log in again, and everything will be solved. Multiple login issues will be cleared out. Now here we have workshops also. Statistics workshops are there, and one research methodology workshop is there. In the statistics workshop, biostatistics, we can see very important experiments like ANOVA, T and Wisconsin test is there, correlation and regression, and chi-square is there. I am not opening, not taking much of your time. You have the access to all the experiments with the workshops. You can just go to any one of them, any open anything. This is ANOVA.
It allows us to make a global assessment of more than two groups rather than just an individual assessment of differences between two groups. While other tests might compare two groups, let's consider a simple example where we measure blood sugar levels across three groups. We want to determine, is it right to compare groups individually? Some may be.
So even the sound is there. If the student want, they can just access it. Then we have the task. For every workshop, task is there which the student has to perform. And using the ANOVA type, one time and repeated is there. Post-hoc text we have one for any Tukey and Kunitz type. Whatever the values in group 1 to 4, they will be writing and calculating. They have to do the run analysis, and the result will be there. Then we have the question and answer round. These are all the questions with the correct answers are there. So whenever the students are working on this particular workshop, they can just have the access of ANOVA questions, and the complete topic will be covered. Similarly, we have another workshop, which is the research and methodology workshop. You can see here everything we've just completed and covered. Similarly, all the protocol writing, data management, execution of the research study, steps of research, everything has been covered here. So let me go straight away to the question and answer round. If any questions are there, anything is there, So we have here the feedback form. If something is missing, something is not up to the mark, something you want to suggest us that it should be this way, so you can just write it. You can just go here to the feedback form and write it, and our team will be happy to contact that particular person themselves, and we make sure whatever suggestions are being given, we have to incorporate it into our code. So just go to the feedback form and just fill it up. We are also available on Facebook, Instagram, YouTube. You can please follow our channels also. Any doubt are there, for any doubts are there, any questions are there, you can please ask. Patil sir is also there, so he will. We are very happy to answer all your questions. Any questions are there, please?
I think, Madam Dr. Rajiv had raised a question regarding vasomotor reversal phenomenon, and then why mean blood pressure is taken was his question.
Yes.
So, particularly when we are doing experimental recording of blood pressure, we generally go for mean arterial blood pressure as a parameter. No doubt, experimentally, we can take this systolic as well as diastolic blood pressures also. But then, while recording in experimental setup, generally mean arterial blood pressure is taken. Otherwise, using this particular software package, you can record both, means systolic, diastolic, both can be recorded. And this becomes more important when we are taking non-invasive blood pressure. In non-invasive blood pressure, we never go for this systolic and diastolic. Means when it is taken using a tail cup, there we have to restrict particularly to mean arterial blood pressure. In case of invasive blood pressure, you can take both systolic, diastolic. So that is the answer to this question. Then, are there any other questions regarding this software package or explanations? Or there are suggestions? If someone wants to give some suggestions in this session itself, we can take up suggestions also. We can provide them facility to unmute and ask. That also can be done. Cannot calculate the degranulation of mast cells. So, Madam, can you just unmute yourself and tell us what is the issue there? Means if there is any issue, we can try to solve that also.
Yes, good afternoon, sir.
Good afternoon.
So after performing the experiment, we have to calculate the mast cells, the degranulated mast cells on the slide.
Right.
So the slide is very big, so we are not able to calculate the cells.
See, there particularly you have to look at degranulated and intact mast cells. So for that we have given sample presentations there in the experiment. In sample presentation, we have shown how a degranulated mast cell appears and how an intact mast cell appears. So you have to count total 200 cells on screen by just moving that microscope up and down. And then out of these 200, how many are degranulated, how many are intact? Those you have to find them. And
sorry, sir, but while moving the slide, still it is not able to calculate properly.
Those things you will have to write down in your notebook. How many of them is as we do in case of total WBC count, differential WBC count. There we are just moving the slide in zigzag manner, and then we go on counting whatever is visible to us in that particular microscopic area, visible area. So similarly, here also you will have to do that. And if still there is problem, then we'll come back to you. If suppose that is to be made more clear and more accurate still, then we can think about it. But you just once try this, and if it is not still problematic, then we will try to improve it again. And this can be done within a week. We will be helping you in resolving this particular issue. There is not a big problem. We'll do that. Is there any other issue, other problems?
Yes, sir. Another one is there. Rajiv sir is saying, in dog BP and HR, how to differentiate between histamine and isoprenaline?
Sir, see, regarding this differentiation, first thing you can do is you can use antagonists. Means if you want your students to find differentiate between histamine and isoprenalin, you can use propranolol as antagonist that will be inhibiting effects of isoprenalin, and propranolol will be slightly inhibiting histamine responses but not totally. Okay, so this is a tricky experiment particularly because there is a concept called as physiological antagonism where we tell about antagonism between histamine and adrenaline. So physiologically histamine and adrenaline are antagonistic to each other. But if we are using meperamine as an antagonist, then there you can very easily differentiate between histamine and isoprenalin. So just you have to use meperamine that will be blocking the action of histamine, not of isoprenalin. This total blockage of isoprenalin action will not be there in case of meperamine, but meperamine will totally inhibit effects of histamine. That way you can do it. Means this is how you can start exploring more and more possibilities of helping your students to look at this particular experiment. Okay, you can give such challenges to them, and then students will be really understanding the concept of physiological antagonism also. Matching bioassay, you are saying you are getting wrong results. Okay, in case of bioassay, what happens is dependent upon selection of the dose. If suppose you are selecting the unknown near to the center of that curve, plotted curve, dose response curve, then your results will become more and more accurate. But if suppose you are going to the extremes of this plotted curve, suppose you are going to 70% of the response or 30% of the response, in that case, the values will slightly deviate. This happens in laboratory setup also. So choice of the standard dose that should be near to the center of the this DRC. That will solve the problem. Integration does not have step-by-step instructions in tutorial. No, they are there. In histamine assay, we are having interpolation related things. We'll once again check it. If there you want it to be more clear, this here the question is in bioassay of histamine on guinea pig, interpolation.
Yes,
Both
interpolation.
experiments do not have
So
step-by-step.
we've also given the full step-by-step guide also for these two experiments.
But still, if suppose they are finding it typical, then we can
Yes.
try to make it still clear.
Sure, sir.
So for GMC Nagpur, if suppose there is a necessity of a separate session, we can arrange a separate session for them.
Definitely, sir. We have also, okay. So we have also given the video for these two experiments to explain how
Right.
these
That's there.
experiments will.
So bias is in both packages,
Yes.
Ecology as well as Ex-Pharm. So our suggestion will be to use both these experiments simultaneously so that the experiment will become still more clear. Okay. So they can try guinea pig related bioassay in Ecology also. There they will be getting demonstration as well as this. How log dose is negative? Okay, log dose comes negative. If suppose you are taking log of 0.5, the value will go negative. There is no problem in that. Normally this happens. When the amount is lower than 1, you will be getting negative values there. So that is obvious, that is natural, there is no issue in that. Log values are not always positive. Log values can become negative. Okay, I think, madam, for GMC Nagpur, we can try to conduct a small demonstration session separately so that whatever problems are there, and then for others also, if such problems are there, we'll be resolving them. All the
Sure.
things are in our hands. If suppose some error comes up, then we can immediately rectify that error and we can provide the corrected experiment to all. No problem is there. So we must thank to this GMC Nagpur team because they are critically looking at this package and we will be improving it. We'll be trying to resolve all the issues, whatever are there.
Yes, sir. We will forward the questions, sir.
Sure, ma'am. Sure, please do
Yes.
that. It will help us to improve our product. Yes.
Okay, sir. Thank you so much.
Thank you, ma'am. Thank you. Are there any other questions? Can we get the experiment tutorial? Sure, we'll be getting. Sure, we'll provide you with this. Raju sir will provide you with demonstrations also. Yes.
So many experiments we have already given the tutorial or demonstration videos. Otherwise, sir, we will be adding the more number of videos.
Yeah, it is self-explanatory. All these experiments, all those things are given step by step. Still, if you feel that we can give it to you, no problem.
Sir, in the learning resources, we have shared many experiments videos, but still, sir, we will be adding it more.
Right, can do that. Okay, I think there are no more questions. So can we wind up the session then?
Sure, sir. Sir, I hope there are no other questions from any participants. So let's wind up. And sir, thank you so much for giving you sparing time, sir, for sharing so many experiments with us.
Thanks a lot, ma'am. Thank you.
Thank you so much. If there's any query, anything is there, you can please WhatsApp us. We are always available on mail, WhatsApp, phone. Anytime you can just WhatsApp us. Or there is another feedback form. You can just write your suggestion there also, and we will make sure, very happy to assist you, and we'll make sure all your suggestions are incorporated. Thank you so much, everyone, for sparing time and attending this demonstration. Thank
Thank you,
you.
madam. I'm leaving now.
Okay, sir. Thank you, sir.